So today we'll be talking about a very important topic, which is pterygium. So what exactly is pterygium? Pterygium can be defined as a degenerative condition of the conjunctiva in which a triangular wedge of fibrovascular conjunctival tissue typically starts medially on the nasal conjunctiva and extends laterally onto the cornea. So this is a very comprehensive definition. So in this definition, it has been conveyed that in this pathology there is the formation of a fibrovascular conjunctival tissue which is typically triangular and wedge shaped, which starts medially from the conjunctiva on that side and which basically extends laterally and encroaches on the cornea. So this is what pterygium is, and let me show you what it looks like. This is what a pterygium looks like. As you can see, this is the extent of the pterygium, and pterygium has three parts. This part is known as the cap, this part is known as the neck, and this part is known as the body. So there is a cap, a neck, and a body of a pterygium. Now pterygium is basically a disease process or a condition of hot climate. What does that mean exactly? Meaning that this pterygium, this fibrovascular tissue formation will happen to people who live in hot climates. So if they were to ask you about this, or if they were to use pterygium in order to make a clinical scenario, or if there's going to be a clinical scenario on pterygium, they will mention that the patient belongs to a locality, to a place where the climate is very hot, or they might mention the scorching summers or something like that, that will hint towards. So these context clues are oftentimes given, and these are very important, and this is why I basically used this particular background. So a degenerative condition of the conjunctiva, जिसमें एक triangular wedge बनता है फाइब्रोवैस्कुलर टिश्यू का, जो कि टिपिकली स्टार्ट करता है मीडियली और जो कि एक्सटेंड करता है लैटरली ऑन टू द कॉर्निया. ठीक है. एंड व्हाट अबाउट द etiology? We do need to know a bit about the pathogenesis. So the pathogenesis is not 100% confirmed, but the most probable causes are drying of the tear film, जो कि normally एक hot climate में ही होती है. यानी drying of the tear film, यानी desiccation of the tear film is a very important initiating factor. The second important initiating factor है ना is damage by UV radiation. Sunlight में क्या होता है? UV radiation होती है ना. So when that UV radiation damages the cornea, right, that can precipitate development of pterygium. So ये initiating factors हैं. What are the factors जो कि precipitate करते हैं? It could be something like a chronic infection or presence of a dusty atmosphere that would continuously irritate the conjunctiva. ठीक है. So ये हमारे पास कुछ important बातें हो गई. We know the definition. We know कि it normally starts medially and extends laterally onto the cornea. We know it is fibrovascular. We know it is associated with hot climate. हमें initiating factors का पता है. Desiccation of the tear film and damage by UV radiation. So what about the clinical symptoms? Normally, initially, the concern is mainly a cosmetic one. It simply doesn't look that good. But there are three types of pterygium. The first type is stationary, which remains the way it is and does not progress. The second type is progressive, in which the pterygium, the wedge of tissue, is fleshy and well vascularized and quite thick. And the third type is regressive pterygium, in which the tissue is quite thin, it is quite atrophic, and has very little vascularity. So the problem with the second type, the progressive type of pterygium, is basically mentioned in the name. Because it is progressive, it will continuously encroach centrally and eventually cover the pupil. So what are the concerns with pterygium? The first concern is that it can cause obstruction of the visual axis. It can basically cover the pupil and therefore cause loss of visual acuity. This happens when the pterygium has become quite advanced. Before this stage, blurring of vision occurs because of induced astigmatism. यानी जब pterygium छोटा होता है, the main concern is cosmetic. पर जैसे कि pterygium extend करता है ना laterally, it basically induces a condition called astigmatism. Astigmatism is basically a refractive error. जैसे कि pterygium की growth होती है ना on the cornea, grow कर रहा होता है onto the cornea, तो basically वो traction exert करता है on the cornea, and क्योंकि cornea पर traction हो रही होती है, so because of this traction जो cornea की shape है ना वो warp हो जाती है, वो change हो जाती है, ठीक है, खिंच पड़ती है cornea पर, and because of the change in the shape of the cornea, the various rays of light which are basically striking the cornea, they are no longer getting converged appropriately, ठीक है, जिसकी वजह से जो image होती है वो सही नहीं बनती, and this is known as astigmatism. So this is the first problem associated with pterygium, and the second problem is कि beyond a certain stage of development pterygium इतना extend कर चुका होता है कि वो pupil को cover कर लेता है, so वो basically cornea में जो pupil वाले area ना उसको cover कर लेता है, visual axis को obstruct कर लेता है, and this is known as mechanical obstruction. Diplopia is a rather rare finding in pterygium, and it basically happens जब इतनी ज़्यादा inflammation हो जाती है, ये जो eyelid है ना that basically comes into contact with the eyeball, and because of that जो extraocular movements हैं वो impair हो जाती हैं, and जब extraocular movements किसी भी वजह से abnormal होती हैं, there is diplopia, there is double vision. ठीक है, so now we are done with the definition, we are done with the context clues, we are done with the etiology, we are done with the main clinical signs and symptoms. What about the treatment? Treatment को हम divide करते हैं into medical and surgical. Initially, when we were talking about the initiating factors, we mentioned desiccation of the tear film and exposure to UV radiation. So in general treatment, artificial tears are applied to keep the conjunctiva moist. Secondarily, sunglasses are prescribed to minimize UV exposure. Thirdly, topical steroids can be used to reduce the inflammation. The definitive treatment, on the other hand, is surgical excision, and there are two techniques which can be employed. There are three stages of pterygium. In stage 1, less than 2 millimeters of the cornea is covered by pterygium. At this stage, if a surgical excision is performed, it is done because of cosmetic reasons. In stage 2 pterygium, the pterygium covers less than or about 4 millimeters of the cornea, and at this stage, the pterygium has extended so much that it is now exerting significant traction on the cornea, and there is astigmatism now. In the third stage, more than 4 millimeters of the cornea is covered, so much so that now there is mechanical obstruction and a significant loss of visual acuity. In stage 2 and stage 3, surgical excision is performed for therapeutic purposes for the sake of getting good visual acuity. Alright, so what are the two techniques of surgical excision? The first technique is known as simple excision, जिसमें आप सिर्फ pterygium को remove करते हैं. It is also known as the bare sclera technique. Why? Because after removing the pterygium, the bare sclera is left as it is. The problem with this technique is that it is accompanied by an extremely high rate of recurrence. Pterygium फिर से बन जाता है, and the second time around it tends to be more problematic. इसलिए we prefer to use the second technique, जिसमें simple excision के बाद जो पीछे bare area बचता है ना, that is covered with a conjunctival flap. Not necessarily with a conjunctival flap, an amniotic flap can also be used for this purpose. Alright, so this is important. There are two major post-op complications which must always be considered. First of all, there is always the possibility of recurrence. The second post-op complication is the formation of a pyogenic granuloma, and if you have Chitoi latest edition on page 75, they've shown an image of a pyogenic granuloma. So these are the two major post-op complications. So what are the techniques of preventing recurrence? The first technique we've already discussed, in which either a conjunctival autograft is taken or amniotic membrane is transplanted onto the tear area, and this is the most widely used technique currently. ठीक है? इसके अलावा we can use something called mitomycin C, which is either used at the time of surgery or after the surgery, and it is basically applied topically. So topical application of mitomycin C is another option. Radiation can be used and argon laser can be used, as well as something called peripheral lamellar keratoplasty. So that's it. I'm hoping this was helpful. If it was, please like, subscribe and leave a comment.